hoarding, depression, and 2 instances of attention deficit disorder. These are personality characteristics of different people that I have reported to over the years. Executives with corporate titles like CEO, president, and director. I'm here to tell you that people in the executive suite, just like the rest of society, live with mental illness. I know this because I've worked for them, and more importantly, because I am one of them. I have lived with chronic depression since I was 8 years old. I also, by many measures, have had a rewarding and successful career in consulting and financial services. Today, I'm here to share my thoughts on 3 vital issues. First, why senior executives should lead more conversations in the workplace about mental illness, including suicidal behaviors and suicide prevention. Second, why I think it's important. And third, some ways we might be able to start some more meaningful dialogue. In the past, we've often treated mental health as a personal issue that individuals must overcome on their own or with a healthcare provider. But addressing mental health conditions such as depression, substance-related disorders, personality disorders, and suicidal behaviors is just as important as addressing any other public health issue. I want to approach mental health from a different personal perspective. It is my personal story. It is a story about one strategy I believe we can all support to positively impact mental health in the workplace by reducing stigma, increasing awareness and support, and thereby reducing the number of suicides. While a change of culture has happened with many illnesses that were previously taboo, there is still a silence around mental illness and suicide in general. This is even more noticeable in the workplace. So how do we break the silence? I think there are a number of strategies, many of which we see today: public service campaigns, mental health parity and insurance coverage, and workplace programs that provide employee assistance, just to name a few. These are all important components to raising awareness, providing support, and changing attitudes. However, I think one of the most effective ways to break the silence is for business leaders that have experience with mental illness and suicide, either personally or through someone they know, to start talking about it. I have worked in places where we talk about religion, politics, and even gun control. Even in America, we do talk about it. Don't get very far, but we talk about it. We talk about our physical health. We've talked about our families and what we did over the weekend. We talk about our aspirations and our goals. So why in the world would we not talk about mental health in the workplace? We don't because the stigma is so strong that the topic is buried. Yet when leaders remain silent about mental illness, there is a discernible and substantial cost to the rest of society. Such silence contributes to the misperception that successful people do not get depressed. It keeps people from seeing that treatment allows many individuals to continue in or return to successful professional lives. Silence also contributes to the myth that people who are brilliant or full of life cannot possibly have so much despair as to kill themselves. They do, every day. As a senior executive in charge, setting the tone and defining the organization's core values is one of the most important roles I play. Living with depression has not always been easy. However, in many ways, it has made me a better person, a better manager, and a better business leader. Living with depression has been challenging, but it has not kept me from succeeding.
The traumas seen by firefighters and EMS personnel, if not handled well, can lead to some behaviors that are damaging both for the personnel and their families. So that was our purpose. That was why we got into that. Both departments had EAPs. Both had department chaplains. South Metro, though, had a program that was a peer support team. And when we consolidated, we adopted that, and we have a 3-prong approach now. We still have the EAPs, we still have the department chaplains, and we have the peer support team. Another peer support member advised they responded to a station after a particularly bad call and diffused 2 members of the medic crew. The excuse me. The diffusing lasted about 45 to 50 minutes, and they allowed the crew to walk through what their thoughts and perspectives were on that call. The call did happen the same day or the diffusing happened the same day as the call. So they were right on it. And both of the medic crews said they go off duty for 4 days at a time. So they were just about to leave on a 4-day. And they said, you know, it was very helpful because they would have dwelt on that call for that full 4 days. So being able to be there right away helped them. The peer support team checked back during their time off, and then when they came back on duty, and they were good. We want to keep moving forward that cultural shift. And we are starting even with the recruits now to impress upon them that, and we've always said that being physically fit was important in our job. But now we're teaching the recruits that it's just as important to stay mentally fit as it is physically fit. And hopefully that will help them through their career.
Before I ever got on the Denver Fire Department, we had a very close family friend that was a member of the fire department. Had been there through all the important parts of my life, been there at my graduation, and then I step onto the Denver Fire Department, and lo and behold, he's one of my training officers. Very shortly after getting out of the academy, that individual committed suicide. But it was merely a blip on the radar. The fire service knew it, everybody was shocked, but not a lot was discussed about it, not a lot was done about it. Throughout the years, every couple of years or so, we had another suicide. Not a whole lot was said about it. It was kind of pushed to the side. Not a big deal was made out of it. No big changes. Then September 11th occurs. I think we all know the significance of that day. Shortly after that, we had another individual that was suffering from some mental health issues, and we had an assistant chief that went to that individual's house with the intent of helping this individual out. I'm going to go help him, but maybe not necessarily all the skills or being able to recognize all the warning signs. And unfortunately, that resulted in a murder-suicide. And so we lost an assistant chief that day. We were all shocked. It was on the news. It was on the news for about a day because, again, September 11th had just occurred. So we had a great masking incident so that we could all kind of, once again, ignore it, move on throughout our lives. But recently, we had a captain, a very well-respected captain, a very highly thought-of captain. Most people would say was the definition of a firefighter's firefighter. Very brave, very macho, willing to help out anytime they could, nothing they couldn't tackle, commit suicide. And now we were at a crossroads again. It's happened again. How do we respond? So we did something a little different than had been done in the past, and we immediately went to the station where the individual worked. We met with the crews, and we made a big deal of it. We let those crews go off. We let them go home. We put them on administrative leave. We sent our peer support teams. We sent our counselors out there. But then we let those individuals grieve. We let them express their needs. We didn't immediately put them in service. We let them know there would be no timelines defined when you would have to go back to work, when that rig would be in service. But we let them come to work and be with one another and then decide what they needed. And they actually bonded. They came very close together. The peer supporters would go out there, the counselors would go out there, but the individuals themselves, they felt empowered to say, this is what I need. But more importantly, I think it actually started the discussion that it's okay to say that you need something. What I'm proud to be able to tell you today is, in addition to all of our other resources, peer support, we have a department psychologist, we have EAP, we have all that. They're all underutilized services. We have a very robust wellness program, a very highly used wellness program. We actually have an in-house physical therapist. We have a PTA. That PTA, you can go out there any day. He's got a line out his door of people coming in and utilizing it. We've had tremendous results. Matter of fact, I'll have to give you a different health insurance story that anybody else can never tell you. Our health insurance is going down next year because of the lack of utilization of our health insurance because our people are in better shape. We're paying 3% less next year for our health insurance. So that's a great success, and it's normal. And Chief Qualman talked about it. Firefighters, we embrace physical fitness. I can get people to come to classes. I can put equipment in stations and it'll be used. How do we get to mental health being the same thing? This year, with the help of Sally and all of our employee groups, we're actually going to be putting on what we call total wellness. And we're going to merge them together so it's seamless. We're going to have our peer fitness instructors out there, our wellness coordinator, our peer support teams, our department psychologist, all out there at the same time and blending the class into one thing and saying this is what wellness is on our department. without the saying this is mental health, this is physical health, this is wellness. And that wellness is important.
Construction industry as a whole, we have 11 million workers in the construction trades. I think often we're overlooked as a major employment segment. Construction is not broken out very often. The industry has one of the highest work-related injuries and suicides. This was brought to my attention through working with Sally that we met through the Leadership Denver, and found out that we have 3 times the instances of suicide than the general population. And there's some numbers up here, 243 suicides in 2013. And construction industry suicide, there is a lot of machismo in our industry. There is a lot of negative stigma around getting help. We have all the bad habits. And when you get over 1,000 employees, which we did this year, and nearly 1,200 around there, statistics happen to us now. So if there's a statistic that you're gonna, 3 out of 1,000 people will die this year. Well, 3 out of 1,000 of our employees will die this year. And we see that. And some things we can do on the safety side where we have industry leading safety, so we're able to alleviate a lot of those other types of things. But mental health, we're really not focused. We have not been focused on that in the past. So how are we moving the needle there? So investing in our employees' health, we do have a full-time wellness coach, and we have similar results to the Denver Fire Department. Our insurance premiums the last 3 years have been flat. We're way under our claims projections this year. We're going to be sending our wellness coach to Sally's mental health suicide awareness program. We approved that this week, and she really gets out. She gets out in front of all of our employees, and we get tremendous feedback to moving the needle there towards people's physical health, but now let's move it upstairs to the mental health. So we have added substance abuse and alcohol treatment to our wellness program now, that hopefully we can start not just treating the symptoms, but treating some of the issues. And we have 3 free mental health evaluations that people can go to a counselor. I personally have sat in conference rooms, dialed the number to our EAP, handed it to an employee and said, okay, I'm leaving now, because they didn't have the courage to do it. So that's our responsibility. Everybody in this room today, it's our responsibility.
At the end of this year, we will have decreased suicide to SPLY, which is same period last year, by about 40% based on where we're at, and hopefully without any other deaths in the next 4 or 5 days. 40% in 1 year. That's not chance. We weren't doing suicide prevention goals and initiatives prior to this year. So we're seeing the benefits from a very intensive and purposeful action this year. We really want to work towards a paradigm shift. We're going to keep on doing what we're doing, and we're going to do it more. I met with Sally a few months ago. She gave us some great ideas. We're going to get some feedback and keep going.
I work for a railroad. I work for Union Pacific. We're North America's largest freight railroad. And suicide by train is a problem for us on several levels, as it is for other railroads in the United States. First, it's an issue for our crews. We have people in locomotives that witness these accidents when they happen. So there's a human emotional trauma for our employees. And then candidly, there's also a business aspect to it, because with the train stopped, we have customer service issues, we have productivity issues, and so there's a real cost to it. Dealing with suicide by train has been part of our industry's efforts, working with the Federal Railroad Administration and other parts of our government to try to get to answers. But our position is we can do more. So I want to finish with just a short story. I have a daughter who's 26, lives in Philadelphia, and she's a dancer and works for a catering company, because that's where you have to pay the rent. She was at work about a week ago in Philadelphia and was walking from one building to another and saw a woman sitting in the dirt by the side of the road holding her arm. And my daughter stopped and asked if she was okay, and the woman said no, that she'd been hit by a car. My daughter offered to help. Can I call somebody? She said, well, my cell phone's dead. So my daughter used her cell phone to call this woman's brother. Well, in the course of the conversation, the woman said that she had stepped in front of the car intentionally in the hope of ending her life, but that the car hadn't been going fast enough. Well, my daughter was obviously quite taken by this and kept talking with her. And because of conversations I've had with my daughter, my daughter said to her, "Can I call you in a week to see how you're doing? I care about you. I want to know how you're doing." The woman said, "Yes, would you please do it?" Well, that night my daughter calls and said, "Okay, I've said that, now what do I do?" Well, working through the resources of the Action Alliance, we've connected with the hotline in Philadelphia, given them the information, and they're having a clinician, a counselor, call this woman to say that my daughter asked that they follow up. That made me feel like a very proud parent of my daughter. It made me happy that I was able to give her resources so that when she was in a totally unexplained situation, she knew what to do and how to act.
But I will tell you that we haven't really got anywhere in terms of tackling this problem in Australia. We've had a national suicide prevention strategy for 2 decades. We have not made a single dent in that. We thought we did for a while, but we actually realised we were miscounting. We couldn't count for a while, and we found that we've been underreporting significantly through the early 2000s on suicide deaths. The official stats for 2012 released by the Australian Bureau of Statistics show that 2,535 people, the highest number in over a decade, died by suicide in 2012. The bad news in Australia is that we have really been underspending in this area grossly. We spend about 80 cents per head of population on suicide prevention efforts every year, 80 cents. We spend 15 cents on suicide prevention research. But the good news for you guys when you travel down under and go swimming is we're actually spending more money on deterring sharks and finding out why sharks bite people. We're spending more money on that than we are on suicide prevention research. Ridiculous, isn't it? There's 1.1 deaths per year in Australia from sharks. Where we've done reasonably well in Australia are these 4 areas that I've circled. We have made access to primary mental health care through GPs, through psychologists, more affordable, more accessible, not necessarily a whole lot more effective. We're working on that part, but that's been a big breakthrough. Related to that is a lot of work I do in the area of service integration. We know that people with mental health problems, people with suicide ideation need integrated services, and that's been a big focus there. But the 2 big key areas are around where we've made big progress, I think in the last 10 years in particular, are around integrated youth mental health. And we have a national service system now designed for 12 to 25-year-olds to access care at the very time we know that the effects of mental illness and suicide ideation will start to manifest. But I do really want to reinforce a point that came up this morning. It's not just about training programs, and I think Deborah's point about culture, about some of the other points here, David made the point earlier. We do have to undertake broader cultural change, and suicide prevention, mental health initiatives have to be part of an overall strategy within an organisation. So if you have programs that are tackling diversity, if you have programs tackling bullying, these are complementary to efforts that are specifically around suicide prevention and mental health promotion.
Our wellness initiative is called Total Wellness, and it's built on those 4 pillars that you see: research, education, awareness, prevention, and intervention. And we talk about wellness with 4 other pillars. So we talk about physical strength as one of those pillars, and everybody knows what that looks like as it relates to a football player. When we talk about personal strength, your family relations, your relationships with your friends, that's one of those pillars under total wellness. And we talk about financial strength as a challenge with young guys in being given a lot of money or earning a lot of money early on and not exactly knowing what to do. Financial strength has to be part of those 4 pillars. And then that next pillar is the one that oftentimes gets overlooked, and that's that emotional wellness or emotional strength. And total wellness has given us an opportunity to have these conversations in a non-threatening way.
So on our website, we try to create some of these models and show some models of NFL players saying it's important and necessary to get help when you need it. And there's also a lot of other educational materials on there, things that can be downloaded by players and family members, information about some of the programs. But I want to play you this video because this is, I think, kind of says it all. This is Michael Irvin. He's an ex-Dallas Cowboy player and is now a broadcast journalist for NFL programs.
To my brothers, and that's what you are. You are my brothers because we are family. We are part of an NFL family. And as family, we do have to look out for one another. The way we did on the football field. We relied on one another. We trusted one another. We gave our all to one another. We have to do that off the football field. We have to trust one another. We have to rely on one another. We have to share with one another. We can't isolate. It's the worst thing in the world for a man to do. The Bible says, confess thy faults one to another, pray ye one for the other, and in this we shall find healing. What it means by that is, when we talk, we find out that we all go through some of the same issues. And you may be able to talk to someone that has been in the issue that you're in and has come out of it, and he can tell you how to come out of it. Let's lean on one another. That's what family is for. Lean on me, man. And if I need help, I'm gonna lean on you. We do it all the time on the field. Let's learn, for our life's sake, how to do it off the field. Lean on me.
NFL Lifeline. Make the call.